The Japanese National Polyp Study found that colonoscopic polypectomy results in a lower than expected incidence of colorectal cancer. However, because a fair percentage of polyps are hyperplastic polyps, and these are often followed up without resection, it is important to distinguish between adenomas and hyperplastic polyps. Thus, in many facilities, either standard biopsies are taken or polyps are resected prior to histopathological examination. Current advances in endoscopic imaging modalities, such as magnifying endoscopy and narrowband imaging, have changed these conventional diagnostic approaches. These imaging techniques, sometimes called optical biopsies, have greatly improved the accuracy of diagnosis of colorectal neoplasms and allow on-site assessment of the histopathological features of lesions, obviating the need for a standard biopsy. However, they allow only indirect assessment of the morphology of crypts or vessels, and their accuracies vary. Standard biopsy has therefore remained the gold standard for reliable pre-treatment diagnosis. Endocytoscopy, which involves a contact light microscopy system integrated into the distal tip of a conventional colonoscope, is a novel emerging endoscopic system. In contrast to other modalities, the ultra-magnification capability of endocytoscopy enables on-site observation not only of structural atypia, but also of cytological atypia. Endocytoscopy has demonstrated good consistency in assessing the histopathology of lesions in the gastrointestinal tract and shown a diagnostic accuracy of almost 100% for discrimination of neoplastic lesions in the colorectum. Endocytoscopy may thus be expected to provide the next generation optical biopsy. However, no randomized controlled trials comparing endocytoscopy with standard biopsy have so far been performed. Mori et al. Therefore conducted a prospective, randomized, noninferiority trial to assess the potential of endocytoscopy as compared with standard biopsy for the diagnosis of colorectal neoplasms. Their findings are reported in a recent publication in Endoscopy entitled Comprehensive Diagnostic Ability of Endocytoscopy Compared with Biopsy for Colorectal Neoplasms, a prospective, randomized, non-inferiority trial. Here is a summary of the report. Background and study aims. Endocytoscopy enables observation at 450-fold magnification during gastrointestinal endoscopy, allowing on-site optical biopsy. Mori et al. Compared the accuracies of endocytoscopy and standard biopsy for the diagnosis of colorectal neoplasms. Patients and methods. The authors performed a randomized, controlled, open-label trial of patients with colorectal lesions greater than or equal to 5 mm, detected during colonoscopy in a tertiary referral center. They randomly assigned the 203 detected lesions of 170 eligible patients to either the endocytoscopy or standard biopsy group. An on-site endoscopist assessed the histopathology of the endocytoscopy group lesions according to the endocytoscopic findings, whereas a pathologist later assessed standard biopsy group lesions by microscopic examination of the biopsy specimens. They calculated the diagnostic accuracies in both groups with reference to the final histopathology of the resected specimens. The primary endpoint was to determine whether the diagnostic accuracy of endocytoscopy for neoplastic lesions was non-inferior to that of standard biopsy, with a predefined non-inferiority margin of 10%. Analyses were by intention to treat and per protocol. The study is registered and the number is UMIN 000003923. Results. Overall, 102 lesions in the endocytoscopy group and 101 in the standard biopsy group were available for primary outcome analysis. There were no complications. The diagnostic accuracy of endocytoscopy for the discrimination of neoplastic lesions was 94.1%, 95% confidence interval 87.6% to 97.8%, whereas that of standard biopsy was 96%, 90.2% to 98.9%, which is within the non-inferiority margin. Absolute difference minus 1.9%, minus 8.6% to plus 5%. Conclusions. Endocytoscopy is non-inferior to standard biopsy for the discrimination of neoplastic lesions. With its advantage of providing an on-site diagnosis, endocytoscopy could provide a novel alternative to standard biopsy in routine colonoscopy.